Hi, I'm John Kane. I'm the chairman of surgical oncology at Roswell Park, and today I wanted to talk to you about why a cancer surgeon is not a surgical oncologist. So on the left-hand side, you can see the engine of a Model T Ford. Very simple, few cylinders, very simple timing system. Almost anybody can work on it. The mechanic at the Ford dealership back in the 1900s, your neighbor, even yourself. On the right-hand side, you can see a modern engine, very complicated, not something that the average person is going to want to tackle. If there's a major problem with it, you're not going to work on it yourself. You're not going to take it to the local mechanic. You're probably going to take it to the expert at the dealer. So you may wonder, why am I talking about engines? And it's a good analogy as to why a cancer surgeon is not a surgical oncologist. A cancer surgeon would be somebody who operates on cancer but really doesn't have a specific interest just in cancer, hasn't been trained in cancer, whereas a surgical oncologist is somebody that has significant expertise in the treatment of cancer, including both surgical and non-surgical options. So if you look at what a surgical oncologist is in 2019, to become a surgical oncologist, you need to do an additional 1 to 2 years of specialized training just in surgical oncology. So most general surgery programs are 5 years. If you're going to be a surgical oncologist, you're going to do an extra 1 to 2 years on top of that. It is also now a board specialty recognized by the American Board of Surgery, and the ACGME is the oversight group for the training program. So there are approved fellowship programs in the United States and North America that you need to apply to. They're very competitive, and if you get accepted, you become a surgical oncologist. And you would have to take written boards, you would have to take oral boards with questions from your peers and other colleagues in your specialty. Before it became a board specialty about 6 years ago, it was managed by the Society of Surgical Oncology. So again, very limited number of spots in the United States. There are frequently more people applying for these fellowship positions than there are actual positions available. So it's very, very competitive. If you're going to train to be a surgical oncologist, part of your training is to understand the biology of cancer. Cancer is not simple, it's very complicated, how it behaves, the best way to treat it. So you spend a significant amount of time during your training truly understanding the biology of cancer. You can do the perfect operation for the wrong reason, and the person isn't going to do very well. So understanding how aggressive the cancer is this really going to be helpful to the patient, really gives you the best chance for a good outcome for that particular patient. You also spend significant time training in other specialties. So for example, when you do a surgical oncology fellowship, you'll spend several weeks working with the medical oncologist, understanding chemotherapy, the side effects, when it would be indicated for that specific disease. You spend time on radiation oncology, understanding the basics of radiation therapy, again, when it would be best for your particular patient and the timing of those treatments in relationship to surgery. And you also spend time on pathology, understanding what's a benign tumor, a malignant tumor, some of the variations of the cancers you treat. So it's not just about surgical training. In fact, probably 10–15% of the surgical oncology fellowship is spent on non-surgical specialties, really understanding cancer from multiple perspectives. We often specialize in only a few cancers. So there are some general surgical oncologists, but most surgical oncologists find 1, 2, maybe 3 cancers that they treat on a regular basis. So you become very good at understanding the biology of those cancers and the operations that go with them. We also work very, very closely with other cancer specialists. So, for example, there's often a multidisciplinary team where the group is meeting every week to discuss new patients, patients who have recurrences. Oftentimes the medical oncologists are there, the radiation oncologist, the pathologist, even the radiologist. So it's not just practicing in a vacuum, it's working with another group of cancer specialists that really help you come up with the best treatment plan for that patient. And you also have to understand the role and the timing of the treatments besides surgery. A lot of times when I see a new patient, they're like, when are we going to do surgery? Can we get it done tomorrow? And first of all, I tell people, if your cancer surgeon is busy, they shouldn't have OR time tomorrow. We're frequently booked a few weeks ahead of time because we're constantly seeing patients with cancer and deciding when's the best time to perform surgery. But more importantly, sometimes surgery isn't the first thing that we're going to do. For many aggressive cancers, such as esophagus cancer, rectal cancer, pancreas cancer, we may do chemotherapy and radiation first, and then restage the patient, and then do the surgery. So we're not just trying to get rid of the tumor that we're going to resect at the time of the operation. we're trying to give the patient the best chance of being cured. And that may often include treating sites of potential metastatic disease, the liver, the lungs. That's not going to be treated with surgery, that's going to be treated with chemotherapy. So really the idea that you're going to go right to surgery as the first part of your cancer treatment is not really always true. Sometimes it's much better to give radiation first for less side effects, or give chemotherapy first to treat the whole body before moving on to surgery. So again, to really reiterate, a cancer surgeon is not a surgical oncologist. There are people who operate on cancer, but that doesn't mean they have unique training in cancer, the overall care of cancer, not just from a surgical standpoint. And so I always tell people you should ask yourself some questions when you're talking to your surgical oncologist. The first question should be is, where did you do your specialized surgical oncology training? Is this something that they just do cancer on the side, or they actually took time out of their career to specifically train in the treatment of cancer? Was this an accredited fellowship, either through the SSO prior to several years ago, or now through the ACGME and the American Board of Surgery? Is your practice only cancer? Are you just doing cancer? Are you also doing hernias and bariatric surgery? Or is this something that you've really dedicated your career to focus on cancer solely and in its entirety? What cancers is your practice limited to? Do you do all cancers, or are there certain cancers that you see all the time and you treat on a regular basis? How many of this particular cancer do you personally treat each month, every year? If you have a surgeon who says, well, I've never seen that before, I only see 1 or 2 a year, they're probably not going to have the depth of understanding and experience for somebody who's seeing several of those cancers every single month. How often does your multidisciplinary team meet to discuss new patients? You know, patients with complex new cancers should be discussed in a multidisciplinary setting to get input from the medical oncologist, the radiation oncologist, to review the pathology. Who are the specific members of your multidisciplinary team? Can you name the medical oncologist that you work with on a regular basis, the radiation oncologist, the pathologist that looks at the cancers that you treat? So I think in conclusion, being a surgical oncologist is a very unique subset of cancer surgery. It's not just somebody who dabbles in cancer, it's somebody who does cancer all the time, has really dedicated their career to treating cancer, to educating people on the future treatment of cancer, and to doing research to improve the outcomes of patients with cancer. Thank you.